So, head sign and symptoms pa rin po tayo. Headache, case history, number 2 po. So, napakaganda po pag nag-aaral ng case para ma-analyze natin. So, case history, a 50-year-old woman had been suffering from headache since she was 18 years old. The headache occurred mostly on the right temple area, were of a throbbing character and were accompanied by blurred vision. So, may mga hint na tayo, ano? The headache were better during 2 pregnancies and worse from taking hormone replacement therapy. She also suffered from insomnia and constipation. Her periods has recently become irregular, and the menstrual blood had a dark clot. Her cheeks were red and her eyes lacked sparkle and looked nervous. Her tongue was red and slightly purple, redder on the sides and did not have enough coating. Her pulse was fine and slightly rapid. So diagnosis, the headache are clearly due to the rising of liver yang, indicated by throbbing character, the location on the temple, the blurred vision, the red cheeks, and the insomnia. In this case, liver yang rises from deficiency of liver yin, which is manifested by the lack of coating on the tongue, the constipation, and the blurred vision. The amelioration during the pregnancies and aggravation, taking HRT, in this case indicates a liver disharmony. The slightly purple color of the tongue indicates a tendency to blood stasis, of which the dark menstrual clot were the only symptoms. So, kahit isa lang po yung sign na yun, talagang patunay po yun sa liver problem. Case history, number 3, a 36-year-old man complained of migraines since the age of 11. The attack came every few months after affecting either side of the head along the gallbladder channel. The pain was sharp and throbbing and was often accompanied by vomiting and blurred vision. In between the severe attacks, he occasionally suffered from a dull occipital headache. He also suffered from high blood pressure, for which he took medication, which however did not control it well. He also complained of a dry mouth, and the interrogation did not reveal any kidney symptoms. He was overweight, and his complexion was dull, pale with a greasy skin, and several small, pale moles on the face. His eyes were very dull and lacking luster. Their tongue was dark red with a redder tip, swollen with a rootless white coating that looked like salt, although he was on a beta blocker, which altered the pulse significantly, so making it deep and slow. His pulse was very weak on both rear position. So diagnosis, the headache are clearly due to liver yang rising, which is evidenced by the severity and throbbing nature of the pain, vomiting, and blurred vision. So in this case, the origin of liver yang rising is in liver and kidney yin deficiency. So this is apparent from tongue, which shows a severe yin deficiency. With antiheat, it is unusual but not infrequent that there are no other symptoms of kidney deficiency. And the dry mouth is the only symptoms of yin deficiency. Exactly the same pathology that is causing the headache is also at the root of the hypertension. His complexion and body shape contradict above patterns because the complexion is dull pale, while it should be red or floating red. And the body shape is overweight, while yin deficiency usually causes a person to be thin. So this is due to the presence of phlegm, of which he has no other symptoms. However, Certain signs show the presence of phlegm. These are the swelling of the tongue, the dull pale complexion, the greasy skin with small pale mole, and the overweight body. So yung lack of siya ng eyes daw indicates din ng severe problem. Parang walang ningning yung mata. So which is he confirmed having which we also be causing the complexion to be dull and pale, contradicting the tongue. So next case history. A 41-year-old woman had been suffering from headaches for over 20 years. Tagal na po ano. And they had worsened in the past year. The headache occurred all over the head and were generally dull in character. So yun, naalala natin yung pag all over the head involved yung kidney. Occasionally, they occurred in the left side of her forehead, in which case, they were sharp and throbbing in character. She also suffered from chilblains, cold hands, feet, and tiredness, and feel cold in general. Occasionally, she suffered a visual disturbance consisting in seeing flashing light. She had 2 children, aged 2 and 6, and she had suffered a heavy blood loss after the second childbirth. Her tongue was slightly pale on the side and her heart cracked. Her pulse was deep, weak, choppy. So diagnosis, there are symptoms and signs of liver blood deficiency. So manifested by the dull headache, the visual disturbances, the pale side of the tongue, and the choppy pulse. So this blood deficiency was obviously aggravated by the hemorrhoids after the second childbirth, which explained the aggravation of her headaches. So liver blood deficiency, in this case, has given rise to liver yang rising, which is causing the sharp throbbing headache on the left side of the forehead. In addition to this, there are also manifestations of kidney yang deficiency kasi meron siyang feeling cold, cold hands and feet. Then there is tiredness. Ang pulse ay deep and weak. So in this case, attention should be paid to treating both the root and the manifestation. So, pagsasabay mo pong gagamutin yung pinanggagalingan at saka yung manifestation. But with the special emphasis on treating the root, that is nourishing the liver blood and tonifying kidney yang. Next is case history. A 13-year-old boy had been suffering from headaches. So, meron po siyang night sweating, weakness, and tiredness for 3 weeks. The symptoms had an acute onset in springtime, and before that his health and energy were good. On closer questioning, his weakness consisted mostly of a feeling of weary limbs. So nagko-complain din po siya ng epigastric discomfort, and he found difficult to describe, saying it was like a feeling of hunger, parang ginugutom, and he could not decide whether it is a hunger or pain, parang ginugutom na masakit, hindi niya alam. This was accompanied by feeling of nausea. In addition, nakaka-experience din siya ng mga joints pains, especially sa legs. Nakakaroon siya ng pagkahilo, restlessness, sleep, and irritability. Her tongue was very slightly red sa side at sticky white coating. Yung pulse naman ay slippery, wiry, rapid, 92 beats per minute. Diagnosis. So the essential feature of this boy's condition, it is acute onset. If we analyze his symptoms in isolation, many different patterns would emerge. So pwedeng damp heat in the joints dahil meron siyang ache in the joints, or liver yang rising dahil meron siyang headache, and irritability, dizziness, or yung deficiency dahil meron siyang night sweating, epigastric discomfort with feeling of hunger, spleen chi deficiency dahil meron siyang weakness, tiredness, weary limbs, and stomach chi not descending dahil meron siyang nausea, nagsusuka. However, if we take the sudden onset into account and consider the symptoms in their totality, it then becomes apparent that this problem is caused by the emergence of latent heat in the springtime. So in this particular case, latent heat manifests as damp heat. So yun, doon nang galing ano. Latent heat occurs when the unexternal pathogenic factors invade the body. So yung pag sobrang init sa labas. In theory, in winter, but it can happen in any season without causing apparent symptoms at the time. The pathogenic factor goes into the interior, turns into heat, and lurks in the interior to emerge later with the sudden onset in springtime. It emerges latent heat manifests with symptoms of interior heat but with an acute onset. So, sa case pong ito ng boy, the symptoms of heat are insomnia kasi hindi siya makatulog. Restless sleep. Yan, irritable din siya. May mga night sweating. So, feeling of hunger, red sides of the tongue, and yun, rapid yung pulse. So, ang symptoms po ng damp heat are the weary limbs. Tapos din yung may ache sa joints. Yung kanyang tongue ay sticky coating. Ang pulse ay slippery. Although yung symptoms ko appear quite complex, the treatment is relatively simple and should consist in clearing heat and resolving damp with a prescription such as Lianfuyin, Coptis, Magnolia decoction. So herbal po yan, mapainumin siya. Kasi yung galing sa labas na init, yung naka-apekto sa kanya. So yun po. Thank you po.